Welcome back. Yes, back to school is just around the corner. We've had a great summer, but as we gear up for the new school year and we start thinking about the tools that our children will need to succeed, we must also think about the fuel that they will need to drive their brains and to make sure that they learn all they can. We're going to have a discussion on nutrition, and here with us today we have Dr. Phillip Swann. He is the acting director of Public Health, all right? And we have Miss Camelot Barnes, and she is a senior health nutritionist, public health nutritionist. Good morning and welcome to Bahamas at Sunrise.
Good morning. Thanks for having us.
Talking about children health and what they're eating in school. Why is this important? Why we got to worry about what the children are eating in school?
Well, we have to worry because the fuel is what will keep them throughout the day to allow them to learn and to focus on the lessons that they have, as well as the energy to exercise and to go through the whole daily routine. And additionally, part of this whole process of eating while you're in school prevents or provides you with this preparation of workplace.
Right.
How do you ensure that you have adequate nutrition, the proper nutrition, as you go into adulthood?
Right. So as we're going back to school, what should we be thinking about as we get our kids ready? Is it more on us as parents, or is it more about the schools?
Well, it's a little bit of both, but the parents are also key in the planning here with our children. So as parents, we want to start thinking about what are we going to be putting in those school bags. We want to start thinking about why we putting what we're putting in the bags to begin with. And so I like to say that the sole purpose of food is to provide the body with nutrients.
Right.
So then you start planning that way. You start thinking about, is this particular food that I'm adding in my bag gonna provide my child with the fuel that they need?
Right.
So those are kinds of things parents want to start thinking about.
Fantastic. From a policy perspective, and let's say from a regulation standpoint, what are some of the things that the ministry has been doing to, I guess, make people more aware and to make sure we're improving the nutrition in our schools?
So from the school nutrition component, the response is a very integral part of this. We would have introduced a healthy school policy, or food policy. So a policy that schools have adopted, Ministry of Education specifically, on banning sugar-sweetened beverages in classrooms and school campuses, as well as reducing the amount of call it high-fat, high-salt, low-fiber snacks in the school tuck shops.
The things we love.
Yes, the things we love and the things that have us on having hypertension and diabetes and obese.
True.
The things we don't love, right?
Things that cost us money.
Exactly,
Yes.
in the long run as well. So as a nutritionist, what's the approach to changing the habit in both the child and the parent, and let's say in the school? What's the process? How do we get it changed?
Well, it starts at home. And so the kinds of meals that parents provide to their children is critical, because then that builds the habit, that they begin to learn, they begin to understand that these are the kinds of foods that would provide my body with the kinds of nutrients that I need. Also, when the parents include the children in trying to choose the kinds of foods that they want, I always say that parents, you purchase the food, you're the ultimate person who makes the choice. You choose, let's say, a banana, an orange, and an apple, and then you ask your child, which one do you want? Versus taking them to the grocery store and saying, which one do you want? The child will probably choose something that will lead them down the wrong road.
Yeah. Or the parents might choose it because, you buy that 24-pocket chip, at least 20 of them going in the house, right?
Right, but remember what we said now. As parents, you got to think about what's in this bag that's going to lead my child to the road to health.
Right.
Because when we choose a food, we're either leading ourselves to the road of illness or we're leading ourselves to the road of health. And so when you pick up that bag, think about that.
Boy, that chip and juice, man, that used to go a long way when I was in primary school. A little chip and Vitamalt. From a medical perspective, what happens in the body when you put the wrong type of food in it? So let's say, you're a child in school and you eat that sugary snack and you down that salty chip and then you drink the sugary beverage. What does that actually do to a child's brain and body throughout the day?
Well, so the brain actually only focuses on and uses glucose to function. However, high levels of glucose in the body would allow the body to release insulin, and so you have this called sugar crash afterwards. So a lot of energy, and then all of a sudden you have no energy at all. So the child is sleepy at the end of the afternoon, can't pay attention because it's just basically low energy. When it comes to the salt, over a long time period, you're building up the system to become more tolerant for salt, and therefore high blood pressure comes into the whole mix, and that leads along that pathway in the long run. And again, you also at this time are creating your palate. So you mentioned that you want to chip and you want to buy them all still because that's what you ate while you were at school.
The collective we.
Yes, collectively, right? So, but I mean, those are some of the things that were available when we were in school. You know, average, you go to the tuck shop and you got a chip, you got a crunchy bar, and you got a soda, or juice sometimes, but no water was available anyway. So those are the things that you're trying to get parents to understand. You're setting your child up for lifelong habits that will have an impact on their health now, and as they get older, on their health going forward. And you know, you have issues where your child having hypertension, diabetes, and you don't have it, and you're trying to figure why. Well, because they're exposed to those things longer than you were.
Right. Very well said. As we think about shopping and we're going in the stores and we're ordering in bulk, what are some nutrient-dense, healthy foods that we can use as alternatives for the typical everyday cheap snack that might be easy to buy?
You're stuck on the snacks.
Yeah.
Okay, so I like to say that parents should think food groups. So when you go into the grocery store, shop by using your food groups. You want to make sure that your child, first of all, get the adequate vitamins and minerals that they need, right? What do we mean by that? People talk about the vitamin C and they think we only should take them through supplements, but we can get them through food. So when you go to the grocery store, then you can get whole foods as part of the planning.
Right.
What do I mean by that? It could be outside on your garden too, in your tree. You can go and you pick a fruit, or you can go and you pick something that you've grown in your backyard or your neighbor's backyard or something. You want to get foods, as Dr. Swann would have just mentioned, you want to get things as with low sugar. You want to get things that has very little salt in it as well when you're thinking. There's so many processed foods out there on the market. So what I'm saying is that you look for those kinds of things. Low sugar, low salt, low fat. Those are the kinds of things, those is how you would prepare for your children. I spoke about the fruits. I spoke about, there's also things like whole grains that you can get, that you can add to those. And you can, learn to read labels. And you can just read the front. It doesn't have to be very complicated. You want to get things that are rich in fiber. Those are the kinds of things that are going to provide those nutrients that your children are looking for.
If it grow on a tree, then it's for me. If it come in a box, go kick rocks.
Right? I like that.
There you go. We can patent that right there. Right there on Bahamas at Sunrise.
I like that.
So we talked about some of the controls the parents must put in place and help to change the behavior. What are, when all else fails, how is the ministry going to curb? Let's say there's going to be those who still, they might be sneaking their candy and juice around. What are some other ways that we're going to discourage bad eating in our schools?
So again, we've just tried to partner with the schools, and we also partner with the vendors who provide food for the schools. The Ministry of Education or Department of Education has started a school breakfast and expanded the school lunch program. And that's something we've been advocating for a long period of time. We feel that if we as a organization, as a country, provide lunch and breakfast for our children, first of all, we get them into the schools on time and they're there, because there's no argument that I don't have no food, I normally need to buy lunch. And then you now have the opportunity to put before the children only healthy options and get them along that path of healthy eating. And I think that investment is probably going to be better than trying to invest in greater hospitals and more fancy equipment to take care of persons when they become ill later on. And that's just from a quote-unquote big brother perspective. Right. But the other component is, how do we get the messaging out about the foods that we talk about, how they're bad for you. And so we're talking about our public relations campaign to try to put some of that stuff out there on billboards, digital media, social media. Right. And finally, policies you mentioned. So policies, usually when it comes to trying to encourage healthy eating, comes in the form of taxes. And that's something that we've been reluctant as a set of people to try to bring to the fore. But we've been advocating in the Ministry of Health taxes on, specifically right now, there's something called industrial produced trans fatty acids, which means these are stuff that have absolutely no food value and no benefit for the body, but they are tied to stuff like heart attacks and arterial disease, atherosclerosis. So these are some of the things that we're trying to figure out. How do we balance the autonomy of the individual, but how do we also protect the individual by reducing the environment that provides the unhealthy food, the obesogenic environment, we call it.
Yeah, man, y'all gotta protect us from ourselves, man. We be eating chip and
We will
juice
try
all day.
to help you to make the right decisions.
That's right.
And put the environment in place and
Right.
let you make the decisions, but put the options there at an affordable way. So, you buy a bottle of water these days, it's the same as the cost of soda.
Right.
If you have the choice, if you're not, in tune, you've not trained to appreciate the value of water, you will go for the soda because as far as you're concerned, that's more value for your money.
Yeah, man, water and not soda, right? But I've learned so much this morning. Just tell me before we go, give me a healthy breakfast idea right now, on the spot.
You can do pancakes.
Ooh,
You can do a fruit.
right,
You can put mangoes on top of that pancake.
there you go.
And you can have some sardines on the side.
Boom.
It may sound different, but what you're getting is that protein, that carbohydrate that you need for energy, and a fruit for your
Fantastic.
child.
I can go find me some sardine and mango right now and make me a sardine mango salad. I appreciate y'all being here this morning. I learned so much, learned what we should do and not do when it comes to our children's nutrition. And we look forward to healthier Bahamas. And we thank you for all the work that you do and look forward to slapping them chip and honey bun out of the cheering mode all year long. Thank y'all so much for being here this morning.
Thank you for inviting
Thank you.
us.
Thank you. You're watching Mamas at Sunrise. We'll be right back.